I think it was a great opening for another panel discussion, which will be focusing on systemic changes in early childhood development. And I would love to invite to the stage the panelists, Mihaela Ionescu, Program Director of ISSA, who works Actors Organization to drive early childhood initiatives. Wherever you want. Then Agata Dato, Head of Programs of Eurochild, focusing on policy and program development for children across Europe. Then we have Annamaria Cosatti, Program Manager of the Human Safety Net. Welcome. Lucie Plešková, Early Childhood Development Specialist at UNICEF. Martina Švekušová, Paediatrician and ECD consultant from the Early Childhood Intervention Center in Košice, Slovakia. And the last but not least, Maria Herczog, Economist and Sociologist. Welcome. Welcome and thank you for being with us. I hope you feel great after these great examples. And let's dive deep into the discussion. I have an opening questions for you as well. It's not the billboard question, but it's very similar. If you have a superpower to implement one belief in the head of every policymaker in the world, so they wake up tomorrow and they have a new belief system with this one belief, what belief would you implant into their head? It's to all of you.
Okay, so I guess listening to all the presentations and all the rich knowledge base behind that, I guess one thing the politicians should do is making much more efforts to do research and proper data collection and information gathering on what do people think. Because I have the impression, based on all the presentations, that there are some missing components here. We do not know how exactly people perceive early childhood education and care versus family-based care and parenting. On the other hand, there is no clarity on the division of labor between the state, the communities, and the families. It's absolutely not clear, although if we want to be sure that we are catalyzing the system change, we should be absolutely aware of that. And also we should find a place of early childhood education and care within the whole education system, because it's also sometimes biased. So I would like to ask the politicians and policymakers to invest into the clarification of all these triggering questions, because if we are just moving on and developing new policies, new practices, but there is no whole picture, then, of course, we will never get where we want to get.
So what's the one belief you will implement? Because this is very broad answer, I totally understand, but if you name the belief that will be in their heads, like very simply, what belief it would be?
Of the people?
Yes, of
well, I guess there are a lot of misunderstandings, a lot of mixed feelings, a lot of sentiments and less rational understanding, but also many parents are struggling with the guilt feeling. If they stay at home, they feel guilty. If they are working, they feel guilty. If they are placing their children into the early care settings, they feel that they should stay at home. If they are at home, they feel that they should earn more money, they should provide
I understand.
better, and
I understand.
so on and
Let's
so
not
on.
talk about the parents.
So you
maybe
recognize the feeling.
Yeah, understand. Maybe let's continue with the question about the others. So maybe this is not an easy question, so we consider it. But what belief would you actually bring to the head of policymakers? Just very simple. It's just an opening question, so we know what mindset is really needed from this narrative change.
So from the general point of view, to make it very simple, I would just wish they believed in early childhood, that they believed that it's worth investing in it, that it really is an important issue and that it offers a window of opportunity for solving or really dealing with many different problems. So that would be the belief. And then from my slightly narrower point of view of a pediatrician, I wish that they understood better the importance of early childhood in tackling many public health problems that we are facing today. They really understood that that promoting early childhood development is the ultimate health promotion policy.
Thank you.
It's not an easy question. If I have a superpower, I would have believed all policymakers that early childhood development system is a national infrastructure as essential as hospitals, highways, energy grids. And I really hope that if they all wake up tomorrow believing that early childhood development is not just a social program or welfare or something nice to have, that they would really prioritize it as they do like public safety or electricity or water systems for us.
My message will be everyone counts. So bringing the perspective of a corporate foundation, there are actors that could be part of this journey, other actors that could be work side by side with the governments, with third sector, with the NGOs. So everyone counts in this journey. So policymakers are not alone, are supported, and everyone could contribute to this journey. So they are the owner. We are there, they are the owner. So just this.
My new belief, the belief I would implant, is the recognition of children as equal partners and their right to participate in decision making and in public policy, even from the earliest years of their life, and in shaping, in a sense, the decisions that affect them. Unfortunately, many often their voices are silenced because of the inability of adults to see, to explore ways of better ways to ask for their experiences. For example, young children could be involved and should be involved in discussions related to early childhood curriculum or child rights, and really, it's really about policymakers investing in supporting and providing the skills and the opportunities for all those who work with children to really make sure that their voices are heard and that they can engage in participatory processes and have their voices heard.
It's easy to become the last one in this.
You can also support something what has been said already.
I totally agree with my brilliant colleagues of everything they've said. Perhaps what I have said in one of the videos, I think that I will wake up and say, hey, this is everybody's business. It's not just me. It's about everybody who holds a decision making in this that needs to really be aware of how their policy making is affecting the life of children. And it's not just about having quality kindergartens or daycares. It's much more than that. It's from the air they breathe, the grass they are walking, the streets they are walking on, the shops they are buying things from. It's everybody's business. So in the moment that they would understand that ECD is complex, but it's on everybody's responsibility and capacity to contribute, then I will feel more comfortable as a policy leader.
Cool. I think this is a big paradigm shift, especially what you said, with children being seen as partners that are really informed and involved in decision making. So yeah, let's talk about system right now, because this is the panel discussion about system. So let's go through the different parts of the system from the theory. And my first question is to Mihaela, to you, because you work with a range of organizations that focus on early child development. How do you see ECD ecosystem, and what are the key elements, like really essential for creating a collaborative system? I know this is a broad question. Just try to be how you see the system when we are talking about comprehensive system. What does it mean? What should we see and what is needed for it?
Well, I'm happy that I'm coming after Ivanka and Lieve, because I think that they've kind of already explained what means a systemic view over early childhood development. And this ecosystem, just by saying eco, and Bronfenbrenner, again, was genius. It's everybody's business, but there are many actors, many services, many environments, as we are talking about in developmental environments, that are interacting. So all these pieces are in interaction, and if it's dysfunctional, the system, is because the interaction between all these pieces in the system, be them actors, decision makers, policy makers, services, and practitioners, and families. So if the interaction in between all these actors and pieces of the system are not functioning well, that's not an ecosystem. It's a dysfunctional ecosystem. That's one thing. The second, and I'm again applying to what they were saying, we saw, you know, a fantastic leader, yes, that has a vision. We saw a city that said, we have a vision. I think this is from where we start. Do we have a really shared vision? Where do we want, what do we want for the children? Asking them too. I think shared vision is perhaps one of the most powerful things that can be co-constructed between those that really want to make a difference for the country, for children. But having a shared vision doesn't necessarily mean that there is a shared purpose, because they're coming from different interests, views, understandings, and to create that kind of shared purpose, there needs to be a dialogue and a shared language. And I think that's another issue that we are also seeing in the ECD field. We talk about different concepts that I'm not sure that all of us are understanding in the same way. Let alone, we might have a shared vision, we might have a shared language and a shared purpose, but then how we establish this dialogue and we negotiate and we find a common ground and agreement, or where do we want to go, that cannot happen without having infrastructure for that. And I totally agree with Ivanka. If a working group, or whatever we are going to call it, does not really bring people to the table to discuss, and not the same people, and not only some people, but to bring voices that are coming from all those actors that matter a lot in the ecosystem, it's going to be very difficult to really advance something that is complex. We have to agree. It's very complex, but it's not impossible. But it's a different, totally different shift in the mind of people of understanding the age, what is needed, and how the pieces that we are talking about cannot really make a difference alone. It's something that all of them contribute to a shared purpose. Well, this infrastructure is so important, and I think this is something that people are not used to do. So we are in an age in which we have to understand that we can't do the things as we used to do. We really need to shift our way of understanding that they are too complex. It's not going to work by having, even if we have wonderful kindergartens in all the country, it's not going to solve the problem. The problems are becoming too complex. And parenting support, it's something that does not exist as a policy level at a country level. There are few attempts, there have been, and they continue to be, but it's not seen something that belongs to the early childhood system itself. We talk about, do we have enough creches? Do we have enough kindergartens? Are they of good quality? Do we monitor them well? Is it clear what actually means quality? That's fine, but it's not going to solve. Poverty is complex, it's not going to. And it's about so many professions coming together. So working together, it's a different way of understanding how do we work together. We have plans, we might have beautiful strategies, but how we make them happen, it's something that we're on the way of learning. And there are good examples, and I think that we can start collecting such examples, and I think that's the new narrative.
Yeah, I will jump in, because I think this was a great answer to see what we see by ecosystem, and that we also really need to focus on interactions and also include maybe the roles that we don't see as parents, which is super important. And the challenge you mentioned about collaboration is not just here in this ecosystem, but I think it's here in the humanity, how we should collaborate and create this. Let's move on to the policy changes. And Agata, Eurochild focuses on promoting children's rights across Europe. So from your experience, what policy changes do you think are most essentials to build such an integrated ECD ecosystem? And if we can be sure, because of time, it would be really perfect so people understand it easily. That's our goal today.
Sure, and I have good basis already to talk on. Of course, ECD represents a particular challenge to policymakers because one of its multi-sectoral nature, DNA really, but also because of the necessity to, in a sense, reaching out a variety of stakeholders, including children themselves, parents and caregivers, and also a number of service provision. So I think the foundation really for effective ECD policies is about creating an enabling environment. What does it entail? I think it entails, one, establishing and developing really robust policy frameworks, regulatory and legal frameworks. Of course, once we have this in place, there's not a guarantee that outcomes for children will improve. And there are many countries with fabulous policies on the paper, fabulous laws, but where still on the reality, on the ground, children are lagging behind. However, I think, although this is a robust legal framework is not necessarily enough, this is certainly important to have it. Mm-hmm. It's a condition as a basis. Otherwise, I don't think things will happen in practice. We really need to have this structure, this mechanism, a working group or whatever, to at least start the conversation. So this is one enabling factor. The second one, and we've talked already about it, is the coordination of different sectors, health, nutrition, housing, learning, etc. And the third one is funding. But we know that this is a sector where underfunds is pretty much spread out. I know that while needed, funding alone will not necessarily bring to systemic change, because although they are necessary, it's necessary to work to better remunerate the ECC workforce. This has an implication on quality of service delivery as well. There's a need, even in many countries, you don't have the mechanisms to actually report on ECD spending. We don't even know, and governments are not necessarily able to report on ECD expenditure across different sectors. So yes, we need more funding. Unfortunately, while needed, this is not necessarily going to make the revolution alone, because I think the discourse, this transition is very much a ethical and political transition. And this is this ethical and political will that will make the systems more inclusive, more resilient, more responsive to needs, and more sustainable. Mm-hmm. So in short, I have also something. I have something else to add. Not only funding, not only governance, but also a better data collection to actually know whether the programs that we are implementing are working or not. How do we ensure that the children, communities, families that are beneficiaries of these programs, that are a part of these programs, actually are included in evaluating whether they work or not, and how they can be improved if they can be consolidated for scale-up?
What I love about this conversation is what short means for passionate people. And I think this is fantastic. I totally like your answer, and I would like to add, what I hear is also that we need a very different measurements. When we are talking about the comprehensive system, we can't use the measurement for the silos that we created. So it's a big thing. Thank you very much. And let's go to another question. It's to you, Annamaria. You are very familiar with creating support systems that work at the grassroots level, at human safety net. So my question is, what does access to system mean for children and families in real terms, and how we can really ensure that the most vulnerable groups are included?
Okay, thank you. Yeah, I will connect my contribution to what Mihaela said. So we know, and this morning we saw very well that not all children has the right to and has access to service and opportunities in the early years. So we think about most isolated, those that are living in isolated and rural areas. So no, all of children have the right to attend and to have access to these opportunities in the early years. In most of cases, this gap is filled by people that is working in NGOs. So NGOs, actors that are working on the ground, they are filling this gap by guaranteeing to these children to have access to alternative, non-formal or informal opportunities. So those actors are those that are able to create this bridge between formal services and universal services and children that at the moment do not have access. What we try to do at the Human Safety Net is to support this, to create this bridge. So by focusing on those children that are excluded or are still not considered in these communities. We have been creating a program dedicated to families, in particular to future new parents, and we have been working since 2017 in supporting parents and supporting children in the early years. And what we usually do is always support our partners and together with them design ways to integrate public services, integrate services that are already there in order to reach more children and try to extending opportunities. So this is what I see as a role of a foundation, and in particular as a corporate foundation. Integrate what is existing and try to enlarge the access. This is what I think.
Thank you. Lucie, you're working for UNICEF, and UNICEF obviously has a lot of understanding of what is needed for system change in early childhood development. And from your perspective of UNICEF, when you see what is needed for creating an integrated system, what are the current gaps in mindset that we see when it comes to ECD, and what shift is really needed for us to see the system holistically?
Thank you for all these easy questions. These are what are the mindset? It's different, obviously, for different actors, but I think that you know the most critical ones has been already mentioned here by our by colleagues. So I think it's really that ECD is undervalued, so it's not seen as a priority often. It's very fragmented on very different levels, so it's more like the separate programs, professionals works in silos with lack collaboration, and the pattern at the national levels is very similar. So like integrated ECD policy is something that we really see very rarely, and so the shift that we need to see is more collaborative and more integrated approach. It's obvious, but you know how to do it. And I think it's also understandable because this is how our systems are designed. So these are sectors, this is how is it funded, this is how is it led. And also like everybody who has ever collaborated with someone on anything knows that this is much more difficult than like, you know, minding my own business and then like ignoring the rest. So what we see is that like really it's so important to bring people together, and we have heard a lot about it like today. And sometimes it seems complicated, but sometimes it's not. It's just about like identifying the right people, providing them space, make them like listen to each other, and you know discuss the vision, the common goals, and then like you know really seeing as different actors what we can do together to work towards these objectives. So this is what actually UNICEF is trying to do on the national level usually, but also on the local levels, like bringing people from like different sectors together. We had a nice example yesterday with James Ivanka participating like here in the Czech Republic, and maybe it's just a start, but really people need to meet and need to talk and need to discuss. And yeah, so that's it. So I think that, you know, this is the shift in the mindset, that we are not the only ones that can do something, that we need, you know, to work together, but it's not easy.
It's not easy, and also it was said about Ivanka that it's also important not only bring people together, but also to facilitate the conversation so they have the feeling that it's really valuable and it has results, which is a challenge to connect these two things. And thank you for this mindset shift to more holistic approach. And Martina, you're a pediatrician and also ECD consultant. I'm very interested when we are talking about healthcare professionals, especially pediatrician, what role they can play in a more integrated service and what shift is needed here, especially in this role?
I think from our practice and from our discussions today, we see that the healthcare system is probably of all the sectors involved, seems to be most rigid and stubborn and the most difficult to reach and include them in the conversation even. And I think the answer to that is looking at the barriers of this cooperation of healthcare system. And they are very much related to what you mentioned, Mihaela, and that is the alignment and perceived mission of the sector and the language that we use. And from that point of view, I believe healthcare providers, especially primary care providers, including pediatricians, need to better understand and embrace the unique role they have. Because first of all, they have the advantage of regular contact with all children and families. No other sector has that. Second, we need to expand our perceived mission from just disease-oriented model, where we focus on disease prevention, disease diagnosis, and disease treatment, to a more holistic whole health promotion. That means we need to shift the system from a biomedical model of care to a biopsychosocial model of care, how it is defined by World Health Organization. And if we make that shift, and it's not an easy thing to do, within the healthcare, then we can be partners to education sector and social sector in building a really comprehensive system of early childhood education and care. And obviously, multiple steps are needed, very practical things are needed to be done, such as changing our pre-service and in-service education of healthcare professionals. We need to consider developmental pediatrics as equally important part of pediatrics as pediatric cardiology or immunology. We don't have that in this region. We don't even have a specialty, pediatric subspecialty of developmental medicine. So it's a neglected part of our training and our clinical practice. We need to change protocols. We need to improve the practical skills of professionals in family-centered care provision. We are not trained to do that. We are trained to treat the child, to examine the child. We were not trained to work in partnership with families. We need new protocols, and we need support for healthcare professionals in that transition. So it's a long way, but if I should, pinpoint just one thing, it's this conceptual shift that needs to be made.
And Martina, can you help me understand it more concrete? As you are talking about changing the goal of the healthcare system, which is really big shift, how can I envision, for example, the moment when the mother will visit a pediatrician in the system that you envision? So what will be different? Very concretely in that visit?
Well, it would be, for example, in how we perceive well-child visits. That right now, we check, for example, the physical health, and then we look for deficits. We check the milestones, and we're looking, is there a deficit? Is there a delay? Is there a cause, or is there a diagnosis? And if there is no diagnosis, there's no deficit identified, we don't really care what's happening until the next well-child visit. So we should move from this point of view to being safe, to safeguard development, to not just screen for deficit, but to really move to surveillance, developmental monitoring, and being partners to the parents and guiding them through the development of their children. And then obviously, if there are red flags, if we see any risks, then cooperate with other sectors and refer children and families early to other services, and then communicate with those services and see them as valuable partners. And we don't have that at the moment.
Just can I quickly react? Because I think that this is a very nice example, and Mihaela can add more, much more, I'm pretty sure. But maybe the shift can be that, the mother is not visiting the pediatrician, but the healthcare specialist is visiting the household and, providing completely different services. And the home visiting is part of other systems. We have abandoned it as something like, no, not needed. And now we are like, working hard to make this shift. But actually, like, there are like, great training modules developed by ISSA on the home visiting and how different role can pediatricians and the health professionals can have. And I think that we can see this also like on other actors and stakeholders in the system, teachers, social workers, everybody who is there providing parenting support and working on this very closely together. So this is, I think, also like very nice concrete examples what can be done differently, not just the way how we are used to do it.
I completely agree. We had more time, we could go into details. Yeah.
I just want to say that there are already steps made. I mean, in terms of that example is the whole program on home visiting, and there are 24 modules for pre-service, in-service training of home visitors on how they can become better ECD professionals by still keeping their professional identity. We have a huge initiative with UNICEF and WHO, Health for ECD. Again, influencing the mindset of those that are working in health system. You're working for ECD, not just for the health of children. So there are examples, and I'm pretty sure that there might be others that are still going in that direction, because if we want to have a cross-sectoral collaboration, we need also all the sectors to understand that they belong to a larger system. And I think it can't go other ways. You work also on the sectoral level, because educators need to understand the same. It's not just about doing your job as an educator. You need to communicate, and you need to have a way of communicating with the health workers, with the social workers. So we need to work sectorally as well as investing in time for them to meet and find out that they have a lot to do together. So that's sometimes undervalued. Time and funds allocated for collaboration, for dialogue, for training together. It is existing, and I see and there are many other examples I can say. Cross-professional training. These people never meet. And if we don't create that opportunity, if we don't create opportunity for policymakers to meet and talk, how can they ever think together about something that concerns all of them? Sorry.
I like the idea of training professionals to be generalists, and that should happen also for healthcare professionals, that they need to better understand the principles of being a generalist in early childhood education and care. So understanding what the education sector is doing, what the social sector is doing, why they're doing things the way they're doing. So even healthcare professionals need to become, in a sense, generalists in early childhood care.
When I'm listening to you, like to all of you, I really like it, and I realize that how important is also to ask good questions, because when I ask questions, because I see the system as it is, I ask very different questions. So when I ask it, you reframe it immediately, because you see it very differently, and then I realize this is also a paradigm which could be very difficult when we are talking about collaboration. Like in my head, or I think in many people's heads, it could be, my God, this is super, super difficult, because they still see it in silos. For you, it's not, because you see it as one system. that actually requires it, and it's a feature of the system. It's the element that we build because we build it from the scratch as a new one, so we see it differently. And I think this is super interesting to have this conversation. I would love to go deeper if we have more time. But the last question on you, Maria, you are a sociologist, and we talked about the benefits of early childhood development, but when we are talking about this integrated system, what are the benefits from the sociological perspective, maybe economic perspective, of this holistic system? So what can it bring to the actors, and why is it important to have it?
So I'm sorry that I'm the only one always who's negative, probably because I'm a sociologist and I have more insight into the details, sadly. But I want to come back because this is an excellent example. You are mentioning, and you are a devoted advocate for health visitation, home visitation. We all agree. Look at Hungary. I'm sorry to say that. Yeah, well, I feel ashamed that the fact of matter is Hungary has got a universal health visitation system for many, many decades. 4 years college training for well-trained, over 4,000 health visitors working in Hungary, 10 million inhabitants, 1.8 billion children, very fewer and fewer under the age of 6 and 3 and 2. But if you look at the model, first of all, the Hungarian government has this totally false image that this is a unique system Hungary has. No one has ever seen it because they don't want to look around and see that there are several excellent health visitation programs. But that's another discussion. We don't go into that. But if you look at the quality of this provision, first of all, I personally have been begging to WHO and the EU for decades to do an evaluation of this system. That has never, ever happened. So we don't know why is it considered as a wonderful opportunity. Should it be universal? What about the training, the content of the training? It's a totally medicalized model, no social medication. No, I was just telling the colleagues the other, during the break that once I was making a presentation at a conference of health visitors in Hungary, and I was giving a very provocative title, Are health visitors social workers? They wanted to kill me simply. Because they don't identify themselves as helping professionals. They identify themselves with the pediatricians. They want to be close to the health system because it has a higher prestige than social work. And obviously, because they are part of the child protection system in Hungary and they have the same mandatory reporting procedures and so on, and obligations and so on and so on, this is a very, very complex issue, showing actually all the symptoms and all the parts of the issues we've been talking about. How can you create a holistic vision, a complex system, where all these stakeholders are speaking the same language, using the same terminology, they have the same understanding on the needs of children, early childhood development. And I want to come back to my original statement, because I find it extremely important that we cannot do all these, what we all agree on, if we do not know more about the people's perception on child rearing, on the ownership of the problem, because I still feel that there is a lot of confusion around that. Whose responsibility is the upbringing of the child? And if you quote, as we always do, the Convention on the Rights of the Child, it has a very clear provision. The primary responsibility is for the parents, for the upbringing of the children. But there is a second point, and governments don't like to look at that. The state has to provide all the possible support to enable parents and families to fulfill their obligations. And this is where the tricky point comes when we are talking about this catalyzing systemic change. How can you convince the governments that they have an obligation to contribute to the well-being of the children to fulfill their rights? Because almost all the countries in the world by now have internalized also, not only ratified the convention, so it is part of their internal legislation, and it clearly says a lot of provisions that they don't fulfill. So I would get back to this point and first clarify how can we convince the governments to have a political commitment and understanding all those elements that were mentioned here, the economic argument, which is absolutely relevant. I mean that the well-being of children and the happy childhood, luckily, means also the best investment into the future. But we shouldn't forget that this is the only childhood we all got. So
yep.
It is also important that we have a happy childhood. It's not only an investment, so it's not a very, pragmatic perspective that they can become taxpayers if we are doing our job pretty well. On the other hand, when it comes to the complexities, I want to mention two very important things which are more policy related. One, that if you look at the EU care strategy that was published last year, it is only focusing on the daycare provisions and early childhood education and care, and just leaving out 2/3 of the European child population who are not attending daycare. And there are no service provisions for the families, for the young children, no community-based support service, not even mentioned in the care strategy, and we should talk more about it. The other thing what I would like to urge you to pay a very, very strong attention on is the upcoming idea of an excellent idea of the UN Committee on the Rights of the Child to prepare a new optional protocol on education. The fear is that already we know that there is a very strong emphasis on the preschool, early childhood education and care, but only 1 year before the school starts. They don't even consider the younger years. And we are now in a position to start advocating for an extended, much more extended and detailed provision on early years provisions, because if this is becoming an optional protocol, you can imagine the consequences for the next 20, 30 years.
Thank you for your answers. It's super comprehensive. I understand the challenges, and I think it's a very nice opening, maybe also for the networking you will have. How can we make governments or other people, I would say, to see, because this is also important, what we see as a problem, what we see as a system, and what roles we see, and also where's the responsibility and ownership. These are like really big questions, but obviously we need to find new answers and not the answers we already have from the old system that was built before. And we have 5 more minutes for questions. So Maxim, do we have any questions for the audience? So can we ask you for a slide of questions? Okay, the first questions, 222. What is the superpower of an ECD advocate? It's a very big question. So who consider yourself to be an ECD advocate?
The passion, I guess, what was mentioned.
The passion.
I'm sorry, but then we would have solved all the problems. A lot of people that are passionate, really. I know a lot of people that are very passionate. That has to be something more than that. I think that we are not perhaps the best communicators. Sometimes it depends what's your message and who's the messenger to whom you're talking to. And I think that perhaps this equation is not yet solved by those that are having a lot of passion. And I think that's the part that we need to become better on how we communicate about this. We are not yet there. Here is still a nice, comfortable and safe place where we talk about all the things, but out there I think there are people that are not necessarily agreeing with many of the things that we have said. So I think if I would have a superpower, yes, I don't know, maybe I would be the best communicator that just by saying the most clever, convincing, compelling things about ECD while I could, but obviously we're not there. So that's for me the part that I'm missing. Why media is not talking like we are talking. Yeah, why don't we have on TV, on radio, you know, all kinds of discourses about young children?
I think superpower of communication is really needed, and I think it's also connected to the first discussion. It's clear, if we have it, we can rule it.
And I think it's very related because we need to better use the media, the communication, to influence the public discourse and counter the disinformation.
Yeah.
We should learn from this magic very effective tools to counter the disinformation, because they are doing a good job. We are probably less powerful and effective. We should learn.
Yes. But the superpower is in communication, is the same, yeah? How to communicate with different... Perfect, we have a clear answer. Learn how to communicate, right? What is the role of a private donors in helping you to catalyze systemic change? And is the philanthropy sector in Europe stepping up to its potential?
Philanthropy, but also private donors. I would focus on private donors. Private donors are everywhere, are also in our communities. So what we usually do is involve also small, medium businesses at local level, because they should support. This is the role, no? They are part of this journey. So as I said at the beginning, we have a role as a corporate foundation, as a business as well.
I think you mentioned it also before. And how do you see the second part of the question? I think it's also interesting if philanthropy sector in Europe is stepping up to its potential, or if there is a bigger space for their potential too.
I think that there is enough big space. So, yeah, in the last years, we have been trying to work together. Many different experiences have been implemented in Europe, but also outside Europe. But there is a big space that could be, in which we could involve any other new actors.
You were talking about collaboration and interactions in the system. They are important, and that's the question. What do you think is the biggest challenge in building relationships within the ECD ecosystem? And maybe, I know it's also broad, if you can just name it like very clearly, this is the challenge, like I'm a policymaker and I need to know, especially the list. What would you name on the list?
Time. Because like many people are very busy and it takes time to build relationships. It really takes time to listen carefully to the others and discuss.
Yeah, but also I guess it was a very important step taken by the EU to pronounce now the integrated child protection strategy, which very clearly calls for the better integration and much better cooperation between the different sectors, which would enable this kind of complex and holistic approach. I guess this could help, and child protection in a very broad meaning, not only focusing on the child protection per se, but child welfare, child well-being, child development.
Speaking of time, the time is a challenge. Our time is over, but I'll check if I can ask another question. Maxim, you are the boss. One more question. Okay. Also, very important question, when we are talking about building connection, it's all about information flow within the system. So what do you think, how can we improve the information flow within the ecosystem? And just give us some creative ideas, and we can leave this conversation with these creative ideas, because we will have 20 minutes break, so we can also start to implement them maybe.
Language and finding a common language, you mentioned something very interesting, and data.
Well, digital platforms, common digital platforms, and who is going to push the information, because it might sit somewhere. So there is a coordination role that needs to be in place. The information will not just get there, or people will not just go there if they are not driven somehow to make sense of that information. So coordination is too.
Definitely, I think platforms are really important when talking about information flow, and I think that also we will talk about the platforms later and about the project places to grow. And talking about information flows, I think right now you can do a lot for changing information flow in the system. For example, one idea, because I like system change and workshop for system thinking, just find a person you think that something could be really important to say. Or if you have something that is important and would like this idea to be spread, just tell it to someone, because there are people, and we know there are people from government, NGO, municipalities, philanthropies, so maybe the information will come and they will be a great idea that will be born here in this place, because also conferences like this are built because of improving information flows in the system. Thank you, ladies, for being with us in the panel discussion. Big applause for them and their contribution.